Hello and welcome to the Completed Life Initiative's latest symposium, Last Hellos, New Models in Global End-of-Life Care. This symposium asks the question, how do we navigate one of life's most transformative experiences, our dying?
Drawing inspiration from Australian poet Elize Munro's observation that these kind of questions summon last hellos. Today's Global Symposium welcomes speakers from Australia to Belgium, the United States to Rwanda, as we explore new models in end-of-life and palliative care.
From the origin of what it means to be palliative in the context of Aboriginal communities, to the scientific inquiry into the effect of placebos, from research into personal narratives of end-of-life visions, to expanding eligibility considerations for medical aid in dying. This two-day symposium invites you to contemplate one of life's most powerful, transformative experiences.
Your presence in this virtual space means a lot to us, and we are grateful for you tuning in today. Be sure to stay till the end of this presentation, as there will be an opportunity for you to join a Completed Life Initiative team member and your fellow symposium attendees at our virtual event cafe. Thanks for joining.
Good afternoon, and thank you for joining us on the Completed Life Symposium around hellos and goodbyes and perspectives from Aboriginal communities in Australia. Firstly, I'd like to acknowledge I'm a Google the woman of the far west coast of South Australia, and I pay my respects to my elders past, present and emerging. I pay my respects to the cultural waters, lands and seas that I work, live and travel on, and respect my spiritual ancestors and elders on the country and the passage that they provide for us on journeys around end-of-life care. I'd like to introduce with me today is MacKenzie that has joined us with our journey on understanding different perspectives. MacKenzie, could you introduce yourself?
Hi everyone, my name is MacKenzie. I'm a proud Aboriginal woman from central New South Wales. Thank you for having me. I'd like to acknowledge the traditional landowners of where I'm calling from and extend that respect out to elders past, present and emerging. And thank you, Cindy.
Thank you, Al. And Elize, can you please introduce yourself?
Thanks, Cindy. So I'm Elize Munro, Gamilaroi woman from northwest New South Wales. Gamilaroi, northwest New South, sits on the what we now know as New South Wales, state of Queensland, state of Australia. I grew up on Wanneroo country and called Maitland home, which is also New South Wales, and I'm currently sitting on Gubbi Gubbi country today and just acknowledging the ancestors and elders of where I'm sitting here today and all peoples across Australia. Thanks, Cindy.
Thanks, Eliza. So today we're bringing you a very diverse representation of the models of palliative care and how Aboriginal communities embrace and have demonstrated and facilitated end-of-life care, or in my way in South Australia, as a Google, the woman of far west coast, we talk more in a culturally sensitive way that it's more comfort care or culturally safe care for our mob. Now, just bringing this conversation to light, when we're looking at the traditions and the cultural practices within the diversity of communities across Australia, which has up to 260 different clan groups. MacKenzie, I'm going to direct this question at you. What do you think the most important qualities and things are to remember when we're looking at end of life for Aboriginal people as they approach, but also as they go through their final days and weeks of life?
Thanks, Cindy. So, as you mentioned previously, you know, there's so many different countries and nations across Australia. The diversity of those cultural practices vary according to community. But some of the overarching, you know, cultural values that are important at end of life, you know, maybe you know include returning to country. So the importance of passing away, you know, where someone belongs and at home, surrounded by family and community. Embedding, you know, and if they can't pass at home on country, that important cultural practices, whatever that is for that particular person and their family and community, and that may be embedding cultural practices within mainstream services such as the smoking ceremonies, or you know having access to spiritual healers coming in, having access to bush medicine. So depending on the person, and what their cultural protocols are in terms of sorry business and sad news will vary, but some of the main ones, and obviously importance of family and kinship around, you know, supporting that end of life care journey and making that, you know, returning to spirit journey as best that it can be in terms and according to the, you know, the wishes of the family, the patient and their family.
So just coming back to those values that you put it in, and that significance of returning to country or being on that place of belonging, is that perceived as normal, or are these quite distinguished practices?
It's quite, from my understanding. Oh, yeah, sorry. From
Yep.
my understanding, quite normal across, you know, quite common across most of our communities, that importance and connection to country and culture. Returning to country, unfortunately, doesn't happen for everyone, even if their wishes are in place. Yeah, there's a lot of challenges that come with that as well. But I think we'll probably yarn more about the advanced care yarning stuff later, or the future planning. But yeah, it's quite common across, and there's significant spiritual and belonging understandings behind returning to country as well.
So coming back to that specific area they come from, and what are those integral practices from that community in embracing that holistic view is what I'm hearing. MacKenzie, can we come to you around what sort of templates or practices different among your communities? Are there particular ways of working?
In terms of the different models and templates that are around, particularly within my community, surrounding comfort care, supportive care, is supporting the family to be empowered on their journey back to the dreaming. And, you know, returning to dreaming is, you know, quite crucial in our being, and that's what leads us to where we are. I think as healthcare professionals, you know, in terms of our models that we have within the healthcare setting, there needs to be that awareness within the healthcare setting of what is integral to us as people and what are integral to the family members. I think especially within different clinical settings, there's protocols and processes that, you know, the mainstream health system thinks is the optimal way. But for us to engage, it is critical that we take in the factors that are important to us as Aboriginal and Torres Strait Islander people and be accommodating to that. And that may be, you know, if we have a loved one in a palliative care unit, that we have got our loved ones there, our extended family, our community. We tend to all come together during that point, and that can be quite overwhelming for health services. But I think through crucial education of the mainstream health system about what is important to us along this journey, we can bridge that gap. I think also in terms of, you know, returning to country, that is critical for a lot of us mob to get back home to where we want to be. And I think, you know, having the system where we can support our loved ones to get back home with all the supportive services that they need to find peace. And I think, you know, communication is critical within this area. And this is where our Aboriginal and Torres Strait Islander workforce plays that critical role in bridging the gap between our health service and our community, and play that really crucial role in advocating as well as supporting the family needs of what is important at that point. So yeah, it's also our health professionals being able to have yarn sessions where we can develop rapport with our First Nations people and talk and develop that connection to make us feel safe within the healthcare setting. As we know, there's quite an extensive history in terms of barriers to accessing comfort care, palliative care as we know it. And we need to break down these barriers to get us to a point where we can support our families to find peace with that journey.
Yeah, I can hear from particularly both Elize and MacKenzie that there is a level of systemic practice by mainstream systems that also seems to almost collide with the cultural protocols, practices, traditions, and those critical values and qualities that are important to both Aboriginal, from what I'm hearing, and Torres Strait Islander people of Australia. MacKenzie, I want to pick up on a point where you really talked about that education and addressing sort of those challenging conversations, both in a mainstream system that's done by health professionals, but also then you talked about how family embrace those types of conversations. Is there a way that can bring that together, do you think?
Look, I think education of our mainstream workforces within the healthcare system and building knowledge about our Aboriginal and Torres Strait Islander cultural awareness is critical. Within the system, there's a lot of unconscious bias, racism, discrimination that's been there. But to fully embrace the comfort care journey requires the healthcare professionals that are providing the care an ability to drop their unconscious bias and actually really embrace our Aboriginal and Torres Strait Islander cultural practices to be able to break down these barriers. In terms of our workforces, I think, within our workforce, we have got an amazing workforce of Aboriginal and Torres Strait Islander health professionals that play that critical role in developing not only the workforce's knowledge, but also supporting the patients, but also making a service safe for our mob to connect with and feel supported within that journey. So
Yeah, I can certainly hear, that brokerage and the importance of that weaving together. Elize, I wanted to come back to some of how you mentioned advanced care planning, or some of those conversations around and what resonates around serious business conversations. Is that a term that resonates with you, and is that a community approach?
Well, in terms of serious business, I've actually never heard that terminology before. Across my travels, I'm not sure about other jurisdictions, other communities, but certainly not where I come from or where I'm professionally based. It's not something. I've heard of challenging conversations when we're talking about having advanced care yarning and future planning yarns, but certainly not the serious business. I do acknowledge it's serious business, but never heard of that terminology as such.
And how is your community, and how do you find approaching those conversations with community around, like you said, those future plannings, and to make sure those critical values of return to country, the spiritual, cultural, traditional practices, how are those had in your communities?
I think as you said before, Cindy, very challenging. It's got to be the right person, the right timing, in the right place around where those conversations can be had. I know personally, I find it quite challenging when I'm trying to yarn with my own family about their future plans, and family can find it quite stressful. In terms of that, but it professionally does, and in all spaces, I should say, it does need to be the right people, the right time, and the right place. So if it's happening in the hospital, are we asking our Aboriginal and Torres Strait Islander health professionals to lean into those conversations with our communities, alongside our advanced care planning personnels that are in the space? Are we taking that conversation in where I'm currently at now in Queensland? It is a conversation in the mainstream that happens with an advanced care planner, alongside sometimes with a Indigenous hospital liaison, which is another Aboriginal and Torres Strait Islander health professional in Australia, or the Aboriginal health worker, Aboriginal and Torres Strait Islander health practitioner, health worker that's attached to the palliative care team, which is a new initiative here in Queensland as well. Is the Aboriginal and Torres Strait Islander health workers attached to palliative care teams?
So what I'm hearing from both of you is that series of joint partnership that brings both lenses of values, beliefs around end of life together to make that possible, to make it responsive to the needs of the patient and family moving in that space. You talked about protocols and safety. Can you see in your communities how, and we talked about some of the systemic barriers, what are some of the emerging practices to create that cultural safety in palliative care and end-of-life journeys? MacKenzie, could you share anything with us on that?
In terms of the healthcare system and to make the system approachable for mob, I think it is critical the environment in which it allows for our Aboriginal and Torres Strait Islander population to feel comfortable in, and that is quite a difficult task in terms of the infrastructure of our environments, to be accommodating for not only our loved ones and extended communities when we come together within the hospital setting. It's taken into consideration aspects that are important to us. I think also is the development of education for both our workforces to be able to support patients along that journey. So one, it's increasing our knowledge and awareness within our Aboriginal and Torres Strait Islander workforce, but also ensuring that our mainstream workforces are well adapted to be able to provide that care. In hospital systems, we've very much got policies and procedures, but sometimes that is not applicable within the context of our being and our situation. And I think it's being adaptable within the setting, but it also extends to taking into consideration our personal preferences on how we want to be cared for. And, for our Aboriginal and Torres Strait Islander loved ones, hospital may not be the most appropriate place. So how are we going to best support our loved ones within the community where they feel comfortable? And it's ensuring that our mainstream workforces are well aware of the time it takes to develop a relationship with our community, to be able to have those appropriate conversations at the right time. And sometimes those conversations are not just happening in a one-off conversation. It may be several times that you explore different things that need to be discussed.
So I'm hearing a lot of this flexibility and adaptability and indeed individualizing the journey that from what the systemic or the health structures. may not be suitable, but I hear quite strongly coming through that notion of community is safe. Elize, could you elaborate on how we create palliative care in a community that embraces all of those values?
Education. It does come back, echoing what Alira said. It's education on both sides, and particularly for our communities as well. Because if we've been doing palliative care for centuries, for thousands and thousands of years. It's just that now there's this white man's word that's been put onto it, which has put that fear into our communities. But we've always cared for those returning spirit and those that are passing away. Education coming back in terms of what's the dying process look like, what's happening to the body as it's shutting down when you're caring for someone at home, which can take the fear out of that, out of that journey for who the carers and the family that are supporting, and not only the family, for the patient themselves, for that person returning, taking away a bit of that fear and explaining what's happening and what's normal process and medications, all those sort of things. So it really does come down to education for community, in terms of embracing that. And I think reframing it too for our communities to take some of the fear out of the palliative care word, and reframing it in a context that we understand as Aboriginal and Torres Strait Islander peoples, and talk about the spirituality and the holistic journey as a whole, and how we used to embrace it previously, before a lot of this westernized modeling came into that space for us. Can I go really back quickly, Cindy, just on something and touch on what Alira spoke to? Just wanted to elaborate.
Absolutely.
Thank you. I just wanted to elaborate really quickly on the importance of person-centred care. So when I'm yarning with non-Indigenous clinicians, regardless, we've got to be mindful that we're not doing culture-centred care in terms of cultural stereotyping our Aboriginal and Torres Strait Islander patients in mainstream services, because non-Indigenous people get educated on one thing and they think that cultural protocol applies to all of us across all communities. So just the importance of that flexibility, as you said, but practicing person-centred care, what's important to that person, as opposed to culture-centred care. Being mindful of cultural considerations, but it still comes back to that person-centred practice.
I think that
And-
also
and-
feeds into the fact of, actually our workforce is talking with the patient and the family, or whoever's the individual that we need to communicate with, about what is actually important to them along the journey.
Mhm.
Like building upon what Eliza has said, it's really building upon what are your wishes, how can we best achieve them, what are the things that are important to you.
And that comes back to that cultural safety of the individual. I'm hearing that cultural safety of the culture and the practice, but it's also then that family and that holistic view. And Eliza, I'm quite interested to come back to hear more when you're talking about return to spirit. Might there be a notion, is a person's life in some way complete, or does it you return, you mentioned?
From my understanding, and just to clarify, Cindy, that's how I've reframed the returning to spirit journey for when I'm yarning with community, to reframe palliative care journey. Returning to ancestors, there's different terminology or rephrasing across the country, but there is no end of life. From my understanding, we don't, our communities, there is no end. It's cynical. We, life, death, life, and we go home. We come, we learn, we go home, we come back again. So that's, it's forever evolving in that sense. So it doesn't end when someone, passes away physically, because that spiritual journey to ancestors, to wherever that journey, whatever that journey looks like for that person's beliefs across the country, is just doesn't end there.
Interesting. And MacKenzie, your view on a completeness, or what's your thoughts?
I share the same thoughts as Eliza in terms of it's cyclical. The life, return to country, and then life again. It's holistic in its approach. It's very embedded in our cultural being.
So even the concept, returning to Mother Earth, returning to totem, all of those sort of cultural elements, that it's still very much returning somewhere, whatever. And we see, Earth as Mother Earth, and returning to country, returning to spirit, totems. It can, vary across our different communities, but there's certainly a common belief across all that it's certainly not the end.
I absolutely agree, and thank you, because that is our way of knowing, being, and doing as Aboriginal people, and Torres Strait Islander people share much the same strengths of that holistic kinship, family, community response to our passing, our finishing up, our sorry, or end of life journey. We were discussing the notion around these important qualities for Aboriginal and Torres Strait Islander people, and how these qualities can be challenged in terms of where they live, or we've talked about where their place of belonging is. MacKenzie, can you talk to me a bit about some of the barriers or some of the challenges if they're in some of the communities in your area?
Definitely, Cindy. I think in terms of access to palliative care, that it has been well documented about the range of known barriers for Aboriginal and Torres Strait Islander people accessing comfort care, palliative care. And they range quite extensively from a lack of awareness and understanding of what palliative care is. I think we've touched on it before, that palliative care is not a term that we use. We go with comfort care, as Elize has previously said. It's something that we've done for thousands of years. There's issues around language and communication issues in terms of a reluctancy to actually talk about the end of life journey. There is mismatching of cultural and religious and health beliefs and preferences. I think it also goes down to difficulty in accommodating our cultural practices that we sometimes do at end of life, whether it be smoking ceremonies and different things that are important to the individual. There's racism within the sector, as well as what Eliza has touched on previously about that cultural stereotyping. I think we've also got a lack of and late referral to initiating palliative care. So because of our mistrust within Western medicine, we are often getting late referrals into the comfort care journey. So it's very late that palliative care, comfort care as we know it, is from a point of diagnosis from someone having a life-limiting illness. It is not just the end of life. And to be able to raise our community awareness around what comfort care is allows us to have a journey that's well supported. There's things like financial disadvantage that goes into it in terms of the geographical location. And I think the big thing is the fear and mistrust in Western medicine and healthcare providers, just purely due to our historical things that have occurred and previous policies. All those things impact on us accessing comfort care measures, and we need to change that. We need to change this narrative to be able to have a journey that's supported in the best way possible.
Right. There seems to be a number of factors that just aren't connecting the dots together to ensure that the quality of life of the journey is not coming to fruition. Eliza, is there similarities around barriers and challenges to access of quality care, quality comfort care?
And I think just for context for our listeners in terms of past policies and practices within Australia, Australia had a white Australia policy, and most of our past practices did model what was happening in the States at the time. So in terms of hospitals, for our people, we see, non-Indigenous, the Western model is you go to hospital to get healed. For us, it's a place you go to pass away. And sadly, a lot of our communities that, where people that when they end up in hospital, they didn't go home. So there's a lot of that fear, which leads into, late referrals and whatnot as well. So that fear around going to hospital, because it's just our view is no, don't go there because you won't come home. And unfortunately that still, it feeds down into our younger generations as well, because there would not be an Aboriginal or Torres Strait Islander person in Australia that has not faced racism within our hospital systems, either directly or within their family. So, and it's certainly still a reality today in 2024, but very much different to the Western model. Not a place to heal, but a place that if you go there, you're not coming home.
Even to get that preventative care, and then what we do see is that late presentation, certainly where they can be critically terminal in hours and pass. Coming off my experience in the Northern Territory and remote areas, in the very top end of Australia, there were significant barriers to access. I resonate with the same stories and narratives we're hearing from both MacKenzie and Elize, that for a lot of top-end communities, you go to hospital, you'll be coming home in a box. And that reluctance of engaging, because our health can predominantly be our second priority. We generally, as Aboriginal and Torres Strait Islander people, have strong pain thresholds and ability to be resilient to a range of chaotic or dynamics within our environment, our personal and our health lives. So I think that it also comes into play on where we position how we have done over years, as all of us have echoed our practices of caring and nurturing and comforting through the whole journey of an illness or a terminal illness that leads us to the end of our life or the end of our journey. I really just want to think about, in coming back to the strength and the integral components that we have as strong self-determined Aboriginal people, and certainly keen to hear both MacKenzie and Elize's views on how can us as Aboriginal communities strengthen ourselves again from this this destructive damage, to ensure that we're carrying our ill and our terminal ones to the right journey. So, Elize, I'm just keen to come back to our self-determination and empowerment of our communities, and carrying on our traditional practices of caring, nurturing for our sick and their journey to spirit. How do we strengthen as communities to do this in your area?
I think just generally, Cindy, coming together as a peoples, nothing without us, nothing for us without us. And currently, all the policies and, around are coming from above and not from community or from Aboriginal and Torres Strait Islander peoples ourselves. We know what works for us in terms of whether it's palliative care or not, in anything, and then we wonder why the gap isn't closing, because it's always been dictated, by non-Indigenous. So it's more community controlled, back in our ways, in our hands, caring for our own, with the support of palliative care services along that journey, but doing it our way, and we're the ones that are guiding that, the patient, their family, and our communities with the support of palliative care, not the other way around.
Yeah, it's actually, and you guys are both right in how we use that support and leverage that support to strengthen how we do what we know we do best, and that is caring for our mob on country with family in our respective places of belonging, and what that journey looks like for us to come back and be with us, and we continue that connection of those that certainly pass away before us. Elize, I wanted to come back to, we were talking about that geographical challenge, and certainly hearing about not having the availability of equipment or resources. I certainly reflect on the Northern Territory. But before I do, I'd like to hear from your perspective, particularly the Torres Strait Islander and their practices of the distance to get to community.
Yeah, thanks, Cindy. So I just disclaimer, I'm not Torres Strait Islander, I'm Aboriginal, but I'd like to, yeah, if I can share a little bit there, that would be good. In terms of Torres Strait Islander, so Torres Strait Islander peoples are a distinct culture, but very much our brothers and sisters here in Australia, for context for the listeners. We Torres Strait Islander islands are at the top of the east coast, above Queensland, and there's quite a few islands, but there's mainly about 17 that are inhabited. Across those islands, it makes it, there's one main island that has a hospital, and the small islands have a primary health care. So there's a lot of caring for, people's at home, very skilled in caring for their own at the end of that life journey. When people do need that extra support, they're taken to the mainland, and that could even look like coming down into Queensland. And unfortunately, a lot of people come down for care and never get to go home, which once again feeds into what we were talking about earlier about not getting back. Access to equipment, although it's really important, and it makes that end of life care journey a little bit more comfortable, because we want to make it as good as we can in that sense. It's really hard to get equipment up there, and I've heard stories about people that are palliative or on that journey requesting equipment, and it gets there after they've passed away. Just the logistics of getting supplies up there. They're onto it now. They're looking at ways they can have supplies closer so it gets to people sooner. But on that note, Cindy, I just wanted to say also, when we're advocating for people, for people to return home for patients, it's important that it's not up to the non-Indigenous doctor to say, well, they can't go home because they need, this and this equipment. If that person's going home to a mattress on a riverbank, under the stars, then that's that person's choice. So equipment is important, but at the same time, if as long as person's not in pain and whatnot, I think the other things, whatever is up to the person, whether they've got the other bits and bobs, doesn't really matter. If it gets them home to country or to community and family and community. So just a little bit on the challenges there, and to get someone home. Cremation is not really in a lot of our cultures, from my understanding, across Australia, but due to financial costs now, people are opting for that. And certainly for Torres Strait Islander people coming down, it's easier to do that part of the sorry business sad news as a cremation as opposed to getting someone home after, because of the cost is just expensive and through the roof. So quite a bit. But yeah, just a little bit on that, Sydney. I think even for some of our communities in the top of Queensland, also very remote, so sometimes getting equipment up as well can be a challenge. So hopefully they're looking at the model where equipment can sit in certain communities and get to people faster.
Yeah, I can certainly reflect on a number of experiences and even projects we looked at. One was a renal palliative care project, looking at the medium age of Aboriginal people surviving on dialysis. Obviously, dialysis chairs, hemodialysis are not available. Peritoneal dialysis is not available in every community, and the high rate of renal and kidney failure within Aboriginal populations is quite significant, both in Central Australia and in the top end. A number of patients within one particular study, we looked at were they given their rights and their choices around hemodialysis or peritoneal? Was there an option to do dialysing back at home? how long had they been on their journey of dialysing, which means dislocating, coming away from their community into a metropolitan township such as Darwin, living in a communal hostel, and 3 out of their 5 days a week are 6 hours a day on dialysis. So we also explored the impacts of quality of life. A number of the self-determination and empowerment components for these patients weren't explicitly clear to them, that they had a right to choose how long, if they wanted dialysis, how long they wanted dialysis, was there another option to have dialysis back at community, or even to withdraw and go home to community and have quite a peaceful death. That's a lot of the barriers in access to either one. Aboriginal people won't go and seek healthcare because of the fear of being dictated to, being removed from their community. So significant homesickness and isolation from family and kin that is part of their strength and culture that keeps them strong. But it also, when it came to the access of medications and equipment in some of the top and remote communities, had to rely on one barge coming from, the closest township that would take 2 days to bring, critical terminal medications required at end of life to keep that comfort. I think it's also another challenge which is significantly impacting on that continuing connection and the grief and the loss associated with either deaths expected or unexpected, is that the water table rises in a lot of the top end areas. Therefore, you can't bury. And as Elize, you were talking about, cremation in the top end traditions, that is against the cultural law. They must be buried as part of their spiritual passage. But in order to do that, for those that have passed away, have to wait until the dry season when the water table lowers, enable to bury bodies. And at some points within those funerals are collective burials of 1 to 2 family members. So it really has a lot more of that destructive impact on being so far away to either access services or to come back. And that continued fear of family and community that they face in uncertainty around sickness and particularly end of life. And I think, as we all agree, that it's our ways of knowing, being and doing that's going to strengthen and embrace and nurture our end of life journeys. So I really just wanted to bring that back, that we have so much strength and knowledge and power within Aboriginal people to influence and shift the health systems, to strengthen and invest in Aboriginal communities and our ways of knowing, being and doing. And to protect the culture and integrity of our traditions and practices and protocols. Once again, it's been a most enlightening and heartfelt conversation with you both. I'd like to come to the conclusion of this session and like to again thank MacKenzie for bringing such strong and cultural informed knowledge to this discussion, and much to Elize. I'd also like to thank you for really sharing, those strong values and principles that we as Aboriginal and Torres Strait Islander continue to advocate and represent. So thank you for those that have come across the globe to learn more about Aboriginal and Torres Strait Islander communities and end of life. And we're happy to see you again. Nakan.